Chinese medicine and acupuncture for patients with depression. TCM views the body as an interconnected organ meridian system consisting of qi, blood, and water. Qi is typically defined as the vital life force that is commonly associated with breath. Qi is typically seen as health in motion or in a stagnant condition. The qi condition of an associated meridian can help a TCM practitioner understand a patient's internal condition. Depression can be categorized as a disturbance of the Wu Shen 5 Shen spirits related meridians in the body. With depression, it is possible that a patient is dealing with a complex type of qi stagnation. TCM philosophy sees depression as a stagnation of free-flowing energy, particularly in the heart, liver, lungs, spleen, or kidneys. These organs and their meridians house a spiritual aspect of the soul that can be related to mental acuity, emotional stability, aggression, courage, digestion, and more. Ultimately, a depression TCM treatment will take into account a patient's psychospiritual state alongside their meridian status. Depression Differential Diagnosis Overview. The heart is related to the Shen, which is known as the spirit mind. If the heart organ is damaged or has qi blockage, the spirit mind of the patient may suffer. Specifically, a Shen blockage may manifest as forgetfulness, poor quality focusing, and a possible loss of consciousness. Long-term grief damages the qi of both the heart and the lungs simultaneously, with a possible manifestation of chest pain, palpitations, and shortness of breath. It is believed that the intellect of the body resides within the spleen. By extension, the spleen is associated with applied thinking, generation of new ideas, concentration, and focus. If the spleen is strong, then thinking will be clear, memory will be sharp, and studying will be good. If the spleen is weak, the intellect may become dull with slower thinking, poor memory, and a lack of capacity for new ideas. It is believed in traditional Chinese medicine philosophy that the kidneys house the source of willpower in the body. If the kidneys are strong, the patient will have drive, enthusiasm, motivation, and determination in pursuit of goals. If the kidneys are damaged, the person will lack drive and initiative, and will be easily discouraged and swayed from his or her aims. The ethereal soul, also known as the liver, Hun spirit. A harmonized liver can result in courage, controlled temperamentality, and the ability to stand up to challenges. If the liver's yin is damaged, a patient may be prone to excess heat, which may manifest as anger, irritability, and difficulty sleeping. Through working with a TCM practitioner, you can gain a better perspective on which meridians are affected in your own body. From there, you can learn which psychospiritual Wu Shen aspect of your body is in need of help. I think this provides a fantastic perspective for people looking to better understand their depression condition. Acupuncture and Chinese herbal formulas can be utilized to bring qi harmony to affected meridians. A TCM practitioner will devise a treatment plan based on a patient's unique pattern presentation at the time of the appointment. From there, treatment may consist of acupuncture, moxibustion, cupping, electroacupuncture, and prescription of herbal formulations. Commonly associated diagnoses of patterns. In a systemic review that analyzed 61 studies, the top 4 most commonly associated TCM patterns of depression were liver qi depression, liver depression and spleen deficiency, dual deficiency of the heart, and spleen and liver depression and qi stagnation. Some of the most commonly used acupuncture points for depression are large intestine 4, spleen 6, spleen 9, heart 7, kidney 3, stomach 36, liver 3, kidney 6, and lung 7. The most commonly used points are generally scattered throughout the arms, legs, and head. Ultimately, there is no one-size-fits-all style for TCM treatments, and every patient requires a personalized protocol based on their presentation. It is fascinating that modern research can hone in on which points are most utilized through the usage of systemic reviews. Herbal formulas can be administered to patients for at-home care between acupuncture appointments. In the previously mentioned study, Zhao Yaosan decoction was the most frequently used herbal formula for the treatment of liver qi depression and liver depression with spleen deficiency, while Chaihu Shugan decoction was used for liver depression and qi stagnation. Further on in the study, it is revealed that the 2 herbs, Chaihu and Baishao, were the most prescribed herbs for depression regardless of TCM pattern. Research on acupuncture efficacy for depression outside the TCM scope. Modern research on acupuncture can analyze the effect of acupuncture down to the cellular level. Research on acupuncture for depression has shown that acupuncture could increase hippocampal and network neuroplasticity and decrease brain inflammation, potentially alleviating depressive disorders. Overall, clinical studies indicated that acupuncture could relieve primary depression, particularly milder cases, and was helpful in the management of post-stroke depression, pain-related depression, and postpartum depression, both as an isolated and adjunct therapy. I hope this has been an informational exhibit of how TCM can benefit patients suffering from depression. Within the TCM scope, depression goes beyond a simple mental imbalance. Chinese medicine views the whole body as an interconnected system that relies on free-flowing qi. If that free qi energy becomes stagnant, it is possible that depression may develop. We encourage listeners to undergo a Chinese medicine-style treatment to gain better information about the status of their meridians. Thank you for listening.